Let us discuss circulatory shock. Circulatory shock is a situation where blood vessels are inadequately filled and blood cannot circulate normally. Be careful because I think oftentimes when students think about circulatory shock or they start to ponder the idea of circulatory shock, they're only thinking about one type of circulatory shock, which is hypovolemic shock, but in fact there are three. So make sure that you can differentiate between them and you can produce examples of them, and we'll make sure to review this plenty in class. Okay, so the first type of circulatory shock is called hypovolemic shock. Hypovolemic shock is a large-scale blood loss. The causes of circulatory shock would be things like vomiting, diarrhea, burns, or hemorrhage, where you're just losing a lot of fluids. This tends to cause an increased heart rate and vasoconstriction, and so the blood pressure is actually equalized in the first stages, but drops off precipitously in the later stages. So it may actually go in undetected at first, other than having an elevated heart rate and constricted blood vessels, which you might not be able to tell, but you could definitely tell about the elevated heart rate. Hypovolemic shock. Okay, the next type of circulatory shock is called vascular shock. Vascular shock is where the blood volume itself is normal and constant, but you experience extreme vasodilation. And so even though you have normal blood volume, it's not filling the vessels because the vessels themselves are faulty. And so this drops your blood pressure. Blood tends to pool in the extremities. There's a lack of blood going to the brain. And okay, so the causes of vascular shock include anaphylactic shock, which swells the airways but dilates the vessels. Neurogenic shock, where you have a failure of the autonomic nervous system, and this includes something called vasovagal syncope. And then a third type of vascular shock is called septicemia, which is a life-threatening bacterial infection of the blood, which is actually quite rare and very dangerous. This oftentimes accompanies other issues such as a urinary tract infection or a lung infection, something that is close to the blood supply, and then if the infection gets bad enough, it can invade the blood supply. And then the fourth type of vascular shock is not really specifically a type of vascular shock, but it's kind of a temporary vascular shock. It's called transient vascular shock. And the examples of this would include things like if you were in a hot tub and you're very warm, all of your vessels would be relaxed and wider because of that. If you stand up suddenly or too fast and immediately enter into a cooler area, this could actually, the body might not adjust as quickly and snap those blood vessels back into place. And so they might remain dilated. And as you're standing up, the blood might pool down into your extremities, and it could cause you to, again, the blood would be shunted away from the brain, and you would pass out as a result. Okay, the third type of circulatory shock is called cardiogenic shock. Cardiogenic shock is your basic pump failure. This is usually caused by muscle damage, infarcts of the heart, or any type of congestive heart failure or cardiac arrest. Anything that actually interferes with the workings of the heart would also cause the third type of circulatory shock. So you think of somebody having a heart attack, but remember that it's not the heart that we worry about, it's the fact that the heart is no longer feeding the tissues of the body. So cardiogenic shock is the third type of circulatory shock, but you probably would think mostly of cardiogenic shock as a plain old heart attack.